Good afternoon, everyone. It's not 6 yet? No. So, good afternoon. Thank you for coming out to be with us tonight. I want to check to make sure you can hear me out there in the audience. Thumbs up. Very good. Thank you. Okay. All right. That better? All right. So thank you all again for being here with us. We are really excited to be able to talk with you about some issues and questions that relate to COVID-19 as it relates to medical perspectives, and somewhat what are we doing as a school system as it relates to COVID-19. And so I'm not going to take a lot of time. I want to thank Commissioner Sankey especially for being here with us tonight, and he has a time on the agenda where he will do some speaking with you about different issues. Also, we have on the stage some of our own people with MPS, and we have MPS employees in the audience in case we're getting stunted by a question, and then we'll call on them and they can help answer. So again, we want to welcome you. Thank you all for coming out to this forum, and we will have at some point in the future some town meetings where we will talk more in particular about MPS and some of the things that we are doing, COVID related and otherwise. So at this time, I will turn it over to, first of all, let me introduce Nurse Rogers to my right, Commissioner Sankey, and also Chad Anderson, who works with operations. And they're on the stage with me tonight. And welcome again. And at this time, we're going to turn it over to Commissioner Sankey.
Thank you, Dr. Moore, and good afternoon to each of you. I want to thank Dr. Moore and Ms. Jade Jones and the other members of this very competent staff for taking the time out to come and to entertain questions from the public. I think that's very important. I'm here as your Montgomery County Commission for District 4. I'm also a nurse practitioner, so I have many years of experience when it comes to health and wellness issues. Now, unless you have been asleep for the last 3 or 4 years, you understand how devastating this pandemic has been and how it has disrupted our quality of life, our way of life, and not to mention the devastating impact it's had on the educational arena. We know that education is still important, and for so many of our children, it's going to be the way out of some of the circumstances we were born into. But we can't have that bright future unless we can keep the schools open so that we can continue the learning process. And so we know that COVID has really disrupted so many things, and we have a preventive measure available to us now that can help mitigate some of the negative impacts effects of COVID, and that is the vaccine. And so a number of people have taken it, but there are still some people who are reluctant for whatever reason to get the vaccine. And we know that is going to be the number one measure, in my opinion, and some of the other healthcare experts as well, to get us back into the classroom and to keep things moving. And so for those who have some reservations, who are hesitant to receive the vaccine, we respect that, and I'm here to try to answer any questions you all may have that's related to the vaccine, and hopefully we can eliminate some of the fears, some of the myths surrounding the vaccine, and by the end of the night, hopefully more people who have not received the vaccine would be encouraged to get it, because it is going to be important, of prime importance in terms of getting us to where we need to be to carry on the educational process, which is very important to all of our children. So I'm looking forward to entertaining any questions, to engaging in any conversation. I'm sure that hopefully there won't be any restrictions on the questions you can ask, because I think it's important that you have opportunity to express your concerns, and hopefully by the end of the day, we would have more people getting the vaccine, and we can reduce some of the numbers as it relates to death and other illness and health-related issues that are associated with this pandemic. So thank you all for the opportunity to be here, and look forward to engaging with you a bit further.
Thank you. Thank you. Thank you, Commissioner Sankey, for that opening. We'll move right into what MPS is doing in our schools, and we would like for Nurse Rogers to briefly go over our COVID protocol as it relates to the pandemic.
Okay.
I think someone will assist you with that, turning it on. There's a small button on the side there. Help to the rescue.
Okay, thank you. What we're doing as school nurses, all of our school nurses have been provided with the guidelines as laid out by ADPH to follow to help mitigate this disease in schools. Once we are notified of a positive, we notify, of course, the administration, and our nurses conduct contact tracing based on seating charts and things like that in the schools that are in place to help us identify those close contacts. And then they notify the parents and tell them about the quarantine and isolation days and things like that.
Very good. Commissioner Sankey, can you talk to the point of how important it is to take quarantine, seriously when one gets a notification to isolate or quarantine? Can you explain a little bit about how that is important to do your part within the community?
Yes, particularly if you have not been vaccinated, and if you happen to be tested positive or happen to test positive for the virus itself, it's going to be very, very important that you quarantine, hopefully at home in a place where you won't be exposed to others if the conditions of your environment allows that to happen. Because if you have tested positive, you're going to be spreading it from one person to the next person if you're not practicing the proper methods of quarantine. And so it's very, very important. It could have a domino effect. One person get it, I give it to Dr. Moore, she gives it to the nurse, and so it just goes on and on and on. And unless we take it very seriously, we may not even be feeling ill as a result of being positive for the virus, but we still are active in terms of being able to spread the virus. So quarantining is very important, and contact tracing is important as well. We can't say enough about contact tracing, because if I have it, then I'm taking it home to maybe my family members, and so we need to test them as well so that it doesn't continue to have that domino effect. So very, very important. And sorry about the phone here. Sorry about that.
No, it's fine. They're interested in the forum. That's fine.
Yeah, okay. And so, again, we can't say enough about contact tracing and quarantine, and it's very, very, very important. But even more important than that, and I'll be saying this all evening or all afternoon here, is that the vaccine is the number one preventive measure. It's the number one preventive measure. And, you know, it's not necessarily 100% effective, but it certainly helps prevent some of the effects of the virus itself in terms of hospitalizations and death. I've taken care of a number of individuals, or known a number of individuals who were impacted. And if you have had the opportunity to speak with any individual that has been impacted by COVID, then you would have a better appreciation, a more profound appreciation for how this virus has just ravaged so many homes and so many individuals have been impacted by it. I was walking through the hospital, one of the local hospitals, several weeks ago, and I saw family members gathered around, and I was on my way to lunch, and I stopped and turned around, and I said, "What's going on?" He said, "Well, my wife had to be put back on the ventilator." I said, "Your wife?" He said, "Yeah, man, she was doing fine, and then she had to go back on the ventilator. And we just don't know, what's going to happen." So he said her mother's is out there outside. So I went out to talk to her mother, and she said, "Mr. Sink, how are you doing?" I said, "I'm doing fine. I mean, how are you doing?" She said, "Well, she said, Mr. Sink, I just lost one daughter in July to this virus." And she said, "I don't think I could stand to lose another daughter." And so it happened. In July, she lost one daughter. In September, she lost another daughter. And so this is just an example of the impact that this virus is having all over the world, And, we here in Montgomery, we've had our share of heartaches and deaths associated with this and disruption of our lifestyle. And so it's just so important that we begin to take this seriously. And, you got questions that might be causing you to be reluctant to get the vaccine. Please, let's have a conversation about that so we can get moving.
Commissioner Sankey, you bring up a good point, talking about the reluctancy. Can you share some of the questions that you receive as a nurse practitioner surrounding the vaccine and why people are reluctant to receive it?
I entertained a gentleman not too long ago, and so you can't just dismiss people when they ask questions about this, no matter how unscientific the question may be. But he was there, and I was engaging him. He was one of my appointments, and he said that the Chinese are tweaking this virus, and so you might have a vaccine for it today, and they can tweak it in the lab next week, and the vaccine that we currently have won't be effective. He said they're doing it, as part of some type of germ warfare. So I could not, to be honest with you, it's not too far-fetched, but, I did not dismiss him, said, "Man, come on now, go on." So I had to sit there and entertain him, and he wanted to know, well, if it's so effective, then why are people still, getting the virus after the vaccine? Well, that was a great question. It's not 100% effective, but it does reduce some of the ill effects of the virus if you had the vaccine versus not having the vaccine. You might get some symptoms, a little chill, fever, muscle aches, for a few days. If you've had the vaccine and then it starts to kick in, the antibodies start to kick in, and then, you reduce some of the devastating effects. But if you hadn't got the vaccine and you get the virus, again, as we know, you could be very, very sick, missed days from work, and not only that, but you could die from it if you make, assuming, you don't make it through the hospitalization, but you can actually help avoid prolonged hospitalizations, and you can prevent death by getting the vaccine. So very, very important. So I entertained him, and we had a very intelligent discussion about it. And if I had had the vaccine in my pocket at the time, I could have convinced him to take it. And so that's another thing. The vaccine needs to be readily available. And I understand that there's some temperature requirements, and so forth in terms of keeping the vaccine in storage. But I think the more we can get the vaccine to the individuals and not just the burden really needs to be on the healthcare providers, in my opinion, in the system that have the vaccines in terms of being able to administer them. And I know they say, well, you got people intelligent and they can think for themselves and they understand the life and death consequences that we're faced with, they need to go out and get it. But if we need to take it to them house by house, street by street, if that's going to improve the outcome, then I'm all in favor of doing that.
Very good. Thank you, Commissioner. I want to double back real quickly to contact tracing that Nurse Rogers brought up. And Dr. Moore and Mr. Anderson, will you all speak a little bit to the importance of contact tracing within our school buildings?
Well, I think based on what we're doing, it's important. I had someone to say the teachers don't have time to do the seating charts. And so my response to that was, that is not something that we are negotiating. When it's time for the nurses under Nurse Rogers' supervision to do contact tracing, they need to know who was sitting where. And so, as I recall, having been a student at one time in my life, we were always assigned seats. And so now it's just a matter of logging that in on a chart of some form so that when they do contact tracing, they will be able to, as a nurse, determine who was sitting where, who was sitting close to someone, who was not. If you were across the room from that person, based on the chart, then we won't have to necessarily quarantine that person. However, if we don't have a clue who was sitting where or standing where at any point of the day at school, then it would be more difficult. And that's where you have these large numbers, 156, compared to one school that had one kid that had to be.
None that happened, just one child?
One child, because they had
okay.
the seating charts, they had everything labeled. They put it in Google Docs. You can go in there on the weekend, which many of us over the weekend have to look at different kinds of information. You can go in there and look at it without having to wait until Monday to know where someone was sitting when you get that call that someone has been exposed. And so it's really important. And I know it may sound like we're being really regimented about some things, but there are times when you have 26,000 students, you have to be able to say, this is how we're going to do this. And that goes with the territory. It doesn't always make everybody happy. We have 26,000 kids. When we have one person who opposes something, there's another great number on the other side who says, I think you're doing the right thing. And so we have to kind of make decisions based on what's best for our students, safety-wise, health-wise. Nurse Rogers, do you want to add anything?
We go back to best practices, as Dr. Moore was saying. That's best practice is to know where these children are in the classroom, especially during the middle of a pandemic. And like Commissioner Sankey was saying earlier, if you've got one child who is positive and there's 6 sitting within that 6 feet or 3 feet or whatever it is, then those people have been exposed and could possibly get it and take it home to family members, old elderly people who are immunocompromised. And that's just, we're trying to mitigate that and stop that from happening.
Thank you for that, Nurse Rogers. And Mr. Anderson, to respond to contact tracing and when we know of, a positive case in the classroom or when we have to shut buildings down, can you just briefly respond to how MPS cleans our buildings and handles those types of situations?
I answered a parent's call. It's been several weeks at one of our schools, and they were wondering, it was a lunchtime thing. Why are we eating lunch in the classrooms? And, when I explained it to them, those tables are not set up for any kind of distancing. And then also you mitigate putting, hundreds of kids in a lunchroom as opposed to having a classroom that may get isolated. I think they kind of understood things. And I think that's a lot of it is a misunderstanding. This is not a virus that's difficult to kill. It's not anything that's that's outside, like we have to do anything special to kill the virus. We follow CDC guidelines with sanitization and disinfection. We've been doing that for years. That's what we train our employees on. And our logistics staff, what their job is to hire, train, and equip those custodians out in the school with the principals doing the day-to-day supervision, making sure. And I would encourage people like teachers or parents, if you have issues with cleanliness or you think something needs to be clean more, reach out to that principal first before you jump over them and come to us. It's a chain of command thing, and I think that principal would appreciate it, or administrator would appreciate it if they would come to them first and allow them the opportunity to address it. And then if it's something that's of greater, like that custodial staff just cannot handle something, maybe it's really high up or something of that nature that they need a little extra help, that's where those custodians out in the school and the administrators know that they can reach out to us anytime. PPE is provided throughout has been provided throughout the pandemic. We're well stocked in that. We do kind of a steady stream of PPE, and then if principals, administrators have a need of a specific thing, they can reach out for that. And then we've also contracted with Centos, and we've put PPE cabinets in each school and given the principals and maybe a person or two a locking cabinet, and if they run out of a specific thing, they can go to that. It's kind of like an emergency kit where they can fulfill the needs, and then Centos monitors that weekly. And we have given guidelines about how often and when and where to go and clean, and we've provided that. The custodians are well versed in it, and then we've also provided it to the administrators to try to help them, because we know they're not custodians, that's not their job, but to give them an understanding of what it should look like and what's necessary. But I really encourage people, if you have an issue, reach out to that school's administrator, give them the opportunity before you try to jump over them and come to another level with that.
Thank you. Mr. Anderson, real quickly, and thank you for sharing that. But for our employees that are watching tonight, will you remind them of the protocol that they should follow should they run out of a spray? I say Lysol spray, but I think you told me not to use Lysol necessarily. But can you remind our colleagues what that process is should they need additional things in their rooms? You mentioned the closets, and I have seen those in the buildings, but just real briefly speak to that.
Yeah, if a teacher's in need of something, they need to reach out to their principal or administrator and whoever is in charge. Like some of the larger schools, it may be an assistant principal, whoever is delegated from that. If they don't know who, go to the principal and ask them if there's masks they need, if there's face shields, if there's spray, if there's wipes. All of that material is supplied, and then if it runs out for some reason and we haven't gotten it there, it's in that cabinet, and they can get that readily. And again, it's stocked weekly. Again, kind of a break in case of emergency type thing, but it's there if they need something.
Good deal. Commissioner Sankey, I want to move back to the vaccine because you're so on fire for the vaccine and promoting that message, and we appreciate it. I'm curious about the Johnson & Johnson vaccine. Is that still a popular option that's in the community? Is there one that you favor over the other?
Well, I got the Moderna, and I don't mind saying that. I don't know why. Of course, I respect individual rights of privacy and so forth, and some people don't want you to know whether they took the vaccine or not. I certainly respect that, and we still in America here, so it's all good. But at the Moderna vaccine, all of them, I don't think they've ever been compared side by side. So all of them are effective. We've done studies in the United States, Canada, South Africa, Brazil, and so all of them proved to be effective, to a certain degree, anywhere from 65% to 95% effectiveness with all the vaccines. I know we've had some little negative publicity with Johnson & Johnson as it relates maybe to some death, but I still don't know if that vaccine was the causative factor in terms of the deaths that were associated with that vaccine. But for someone who cannot get back for the second dose, I think Johnson & Johnson is still an effective option, particularly for the homeless and those people who are homebound, where you got to take the vaccine to them. A one-shot vaccine is more effective than not doing anything at all. Okay. So no problems with Johnson & Johnson from the aspects of being able to get it to those who may be homebound or those who may be homeless, and you may have a little difficulty tracking them for the second dose.
Okay. Now, Commissioner, still speaking to the vaccines, we have a lot of folks in our community that are receiving the first dose, but maybe not returning back for the second. What are your thoughts regarding that?
I think that, again, you know, and I'll take full responsibility for my comments. I think that perhaps we should have done a better job through public health in terms of following up with these individuals. Now, some people took the attitude that you should be an adult, and if you got the first dose, then it's incumbent upon you to show some degree of responsibility and find your way back for the second dose. But it could have been a transportation issue. It could have been an issue of work. It could have been an issue of just people forgetting. You know, and so as serious as this pandemic is, I don't think we should have, you know, just say, okay, well, if you didn't come back, too bad. Someone should have been reaching out, you know, via phone call, because I think we do gather some demographics and we get some contact information when we administer the first dose. And I think, and I believe if we would go back, you know, the public health officials might be of the opinion that perhaps we should have had a bit more follow-up for that second dose. And I was concerned about that, and I brought that to attention of one of the decision makers, and they just didn't seem to think it was necessary at that time. But I believe if they were asked the same question tonight, they may have a difference of opinion, a change of heart about whether or not we should have been very aggressive with our follow-up, and I think we should have.
Okay. And for the folks who may have received the first dose and missed that second dose, can they visit their physician to get the second dose later, and that helps with protection, or do they have to start the regimen over?
I'm not sure just what type of time frame about the waning of time and how effective the first dose is. The second dose might be rather after a period of time. You probably don't get the same degree of effectiveness. Now, the one dose certainly had some degree of effectiveness. It was better than nothing at all. But at this point in time, going back for a second dose might not be the wise thing or the prudent thing to do, but certainly a booster would certainly, I think, be appropriate, you know, if you can get one.
Well, I'm very interested in the booster shots. Can you give us just a brief overview of boosters?
Well, the booster is primarily for those immunocompromised individuals, you know, people on dialysis, people with certain type of cancers. The third dose, because of their immune system and so forth being weakened, the third dose is being recommended. And even for those 65 and older, healthcare workers, that's the Johnson & Johnson, not Johnson & Johnson, Pfizer, is recommending that booster dose. And so I don't see anything wrong with it at this time, because we do know over a period of time your immunity does tend to wane. And so for those 65 and older, healthcare workers who are being exposed every day because of the work we have to do, I think that a booster dose would be effective and the prudent thing to do. I'm just waiting for Moderna. I don't want to mix them because I don't know, I don't have any science on mixing and matching. But as soon as Moderna says a booster dose is available, then I'm going to certainly be the first one in line, because if you've ever been sick, really, really sick, then you know you really would be a little bit more, I guess, cognizant of what it means to really be sick and what it means to be almost, you know, on the doorsteps of, well, death is at your doorsteps and so forth. If you've lost family members and loved ones to this virus or to any deadly disease, then I think it really wakes you up and so forth. And so people concerned about this vaccine having been rushed. But if you were coming home with groceries in your arms, and when you open the door, you heard your 2-year-old baby crying, you're going to drop those groceries on the floor if you care about that child, and you're going to go see about that child. And so I use that analogy to say that when this virus began to hit the United States and we began to figure out what it was and so forth, all of the resources of the United States government became available, and they dropped everything. They dropped the groceries. They came to see about the baby. And so that's why it was produced in what we call a rapid fashion, because all the efforts, all the resources was aimed at finding some way of mitigating the impact of this virus. And so if for those, and this is the United States of America too, by the way, we have resources, we got the scientific community, we have everything we need. So I still don't know why we're so bewildered about this vaccine having come to market so fast. Even in light of economics and, big business and how they manipulate, even with that, being, maybe part of, this overall picture, we still should not be surprised or reluctant just because it came to the market so fast, because, we have the resources to get things done in a very expeditious and expedient manner. So, yes.
Very good. Thank you, sir. All righty. And again, thank you for that. I want to take the conversation over to our little ones. Pfizer recently announced that the group 5 to 11 will soon be able to receive the Pfizer vaccine. Nurse Rogers, do you mind sharing your thoughts just around what that would mean for families?
I think that's important if your child is in that age group, that enough evidence has been shown that the vaccines are fine to take and to give. Just like any other vaccine that your child is given from birth up, this would be the same thing. And we are dealing with a pandemic, a known virus that we have a solution for. Why not do it?
Right. So while we're talking about that age group, and I like to share with people all the time, that's the age group that my children are in that little group. Their best protection right now is the mask. And I want to jump real quickly to a question that we did receive, and we want to thank the community for submitting their questions and their comments. We have all of those. Some are related to things regarding our learning options and things of that nature, but I want the public to know that we will address those at our MPS Town Hall meeting. But Nurse Rogers, a parent submitted the question, hey, listen, my child is in kindergarten and does not like to wear their mask all day. Can you please share some tips on how I can work with that child to keep their mask on? And I know that Dr. Moore is a former kindergarten teacher, so maybe she can lend some tips and tricks to mom. And I agree with you, mom, out there. I have a 3-year-old Vera, a 3-year-old that does not like the mask at all.
Well, I used to tease when I was teaching, and I still consider myself a teacher most of the time, but you can get a 5-year-old to do almost anything for a sticker or a lollipop or, some little treat. So you can always start with that. But I do advocate that, if I were still teaching in the classroom, that I would give my children, young ones or a little older, I would give them a mask break, so to speak. Meaning I'd take them outside in the fresh air, let them be a little bit separate from each other, so that if they get weary of wearing the mask, they have a time when they can go outside and take it off for a minute. And then they would understand as we went out that we're going to go out and take a little mask break, but when we come back in, we have to put them back on. It's kind of like lining up and going to the cafeteria and everybody has to be quiet. I think young children are really good about following rules when you give them some kind of reward to go with it. And it doesn't have to be a big reward. It just has to be something that they can identify with and that they appreciate. Now, that's not going to work for every child. Some children are just bugged by having something over their face and over their nose and mouth. And so those children we have to take into consideration when we're talking about 5-year-olds. However, if every other 5-year-old can keep the mask on and one can't, then you still have a level of protection for the whole class because the majority of the children are wearing their mask.
Got you. Thank you for that. Nurse Rogers, anything to add to?
I agree with everything Dr. Moore said, and also that little ones tend to mimic things that they see their people they love.
I have noticed that the little ones will stand on their dot, their social distance dot.
Yes.
They're very protective
And I think
of that.
if the adults and the older children are wearing theirs correctly, that they'll want to follow suit and want to mimic what they are doing and be cool like them.
Mr. Anderson, you had mentioned this earlier, masks in the schools, or if a child comes to school without a mask, we are able to provide masks to those children, correct?
Correct, yeah, there are disposable masks in that cabinet. We provide masks also to the district. We've provided masks from the start of this. I know we've put out over 100,000 masks in a little under a year out there. So they give those out, and we give those out to the administrators and the custodians to distribute those things. So again, I encourage those employees, reach out to your administrator if there's something you're not sure of. I mean, we can't communicate with just every single person. That'd just be impossible to do. So we try to do something with that central person, that principal or that head custodian, to get that information to them. But those would be your best bet on finding your resources you need.
Very good.
And I would
thank you.
also like to add that, as a teacher, and parents are the child's first teacher, that you can use this mask wearing or whatever as a teachable moment when you talk about it as far as health goes, the science of it, what you're trying to do to protect yourself. Young children learn those concepts. You just have to teach it at their level. And so you can use it as a teachable moment in reading or science or whatever you're teaching at the moment, math even. And they understand it, but sometimes the how and the why, you're asking them to do certain things. If you can tell them why it's important, you might have to tell them and work on it more than once, but I always say 7 times and they get it. So you use it as a teachable moment. Not always, I want you to follow my directions and do this. Why do you need to do this? And I think it helps for young children to know why it is important that they wear a mask.
Right. Early on, Commissioner Sankey, Dr. Fauci was big on the masks, the face coverings and things of that nature. And at one point, we were wearing, double masks. Should the vaccinated continue to wear double masks when out and about? Or is, one that you have on, is that sufficient? If you're unvaccinated, should you wear a double mask?
The one that I have on supposedly is the 3M product that actually prevents some of the finer droplet nuclei from entering the mask. It has the filter on it. So mainly the mask, of course, contrary to what some people think, is to protect other folks from you. You know what I'm saying? So you wear your mask, and it helps prevent some of the droplets from the coughing and sneezing from entering the atmosphere. It really doesn't do anything to protect you from the other person unless they're wearing a mask as well. But this one here, not that I'm advertising this one, but it supposedly prevents things from coming in and it filters things from going out. So I've worn this one, this 3M product, ever since they recommended wearing a mask. The double layer, I suppose, give you a little bit more protection. But yeah, I believe that the CDC is recommending mask in crowded conditions, even outdoors, particularly if you have not been vaccinated. You should wear them. And even for those who have been vaccinated, if you're going to be in crowded conditions, even outside, then the mask is recommended. And I believe K through 12 has adopted a policy where, regardless of whether you've been vaccinated or not, if you come into the building, you need to be wearing some type of facial covering. So wearing the facial covering is still very, very important.
Thank you, Commissioner. Moving right along to community-based questions, if that's okay, if anyone else has anything to add at this time.
I just want to applaud our children for being so receptive to learning and seem like some of the children sometimes are more cognizant of this pandemic than we are. My little 7-year-old grandson, Pop, you need to put your mask on. He said, well, all these people walking around here in Walmart without a mask. And so I tried to take him into, there was a vehicle downtown, an old RV that some people had come into town in. It was just very, very attractive, and I wanted to go in and see the inside of it. And he was with me, and I said, come on, let's check the inside of this RV out. COVID, and he didn't want to go in. So our children are very, very aware of what's going on, and I just want to applaud them for staying with the program and being willing to exercise or utilize the protocols that are being recommended. And so I just think it's important to applaud our children for hanging in there.
Okay, well, thank you, Commissioner. Well, we're at that point.
Jade, I would like to
Oh,
to
yes,
say
please.
something
Go
real
ahead.
quick.
Go ahead. The floor is yours.
And parents, please be patient with us as ADPH updates or amends the guidelines for K-12. MPS will also, there are some new ones that have come out just this week, yesterday, as a matter of fact. We are putting things together. As large a district as we is, it does take a little bit of time to implement some things. So those new strategies will be put into place next week, first of next week.
All right, thank you. And as Nurse Rogers says, anything that comes out of her office, we'll be sure to communicate with our family. So thank you, Nurse Rogers. Chad, please.
And
go
I
ahead.
also, I encourage people out, and when I go out in the district and in the schools, don't wait on somebody else for your own personal safety and hygiene. Take care of yourself. Wash your hands. If you can't get to soap and water, get to hand sanitizer. Take care of your personal safety also. Make sure you try to keep your distance as much as you can from folks. I mean, we've tried to do that. We do that within our own departments, within our meetings. I know Dr. Moore does it with our cabinet. We've done that from a distance and virtually. Try to keep the distance as much as you can and take care of your personal hygiene, washing your hands and making sure you do those little things, before you touch your face and do those things. Make sure you take care of your personal hygiene.
Thank you, Mr. Anderson, for that. Dr. Moore, my colleagues are sending me updates as we're having this great discussion. And another question regarding contact tracing. Again, I know that you have expressed how important it is for our classroom teachers to have those seating charts, but there is a bit of a question about the older children and how they change classrooms. Are we able just to, speak to that just briefly? And I know that we'll address things in our MPS town hall. We've shared that already, but that is a hot topic right now that parents are sending us updates. I do believe.
Right. So I see this as the same thing. If you're going to go into a classroom with a teacher, then you're going to have a seat, and then that teacher needs to have a seating chart. It might be different from where you just left. I would suggest, if I were, say, a high school principal, that I would say to teachers, look, try to assign them to the same seat or number or whatever in every room to make it a little bit easier. But every room, which we then upload to Google Docs, then they can look at that and see, if you were in science, here's where you were sitting. Because they're going to look at one room at a time in those cases. So I still think the seating charts are super important, and changing classes really doesn't change that at all, because when you change, you're going to go to another room and you're going to be in a seat. And so there should be no problem with having a seating chart in every classroom with every teacher.
Thank you, Dr. Moore. Nurse Rogers, anything to add to that, or?
I agree. It's quite doable for each teacher to have a seating chart. I've been in a couple of the high schools, and students are not in their seats like they should be, and I think it would be so helpful to have assigned seats in every class. And it does make it very difficult for our nurses to try to do contact tracing when there's not any seating charts available.
And thank you. And Chad, you've already gone over those cleaning protocols, so I won't put you back on the spot to say that. But again, to the public, we are sanitizing our buildings. And one question did come in, just to remind the public, Chad, about our buses. We are sanitizing our buses when they drop off and pick up. Is that still correct?
Correct, yes. We supplied electrostatic sprayers, and you can look that up. It charges the ions in the water, in the chemicals, which makes it like a magnet, and it will attract to whatever. It'll wrap around whatever is there. You don't have to physically spray it like you would like an aerosol can. It will wrap around it. So that we purchased those at the beginning of this. We had some actually before the pandemic that we were using for flu season and trying to help with those things. But we purchased those for every school. We purchased those for the bus department as well. And then we have it centrally, and we go out during the nights and weekends with a central spray team from logistics, and we're spraying the buildings, kind of do a heavier spray than what the custodians might be doing on a daily basis or should be doing on a daily basis at the end of the day. And then our transportation department, from the start of this, what they do is after the morning run, they take and spray the buses down, and then at the end of the day, after the afternoon run, they do it again, spray those buses down.
Mr. Anderson, to relate back to the seating chart conversation, is there a seating chart on the buses?
Correct. Yes, ma'am. There's a seating chart on the buses, and those students sit in there. The State Department came in early on at the beginning of this and told us to use bus capacity for the buses. So whatever is normal bus capacity, that is the seating in those. So whatever it is per seat, per bus. If it's a 72 passenger bus, you can seat 72 people there. And we encourage and require the students to wear a mask on the bus, and we've also provide the disposable masks so that if they try to get on the bus without that, we encourage our drivers to make sure that they put those masks on as well.
And we want to thank our drivers for all that they do day in and day out. So we do thank our drivers and also our nurses as well for what they do. So thank you.
Also, I want to add to that, DOT requires masks on buses. So even, if you're in a place where a mask is, you have a choice, on a bus, you don't have that choice. On a bus, you have to wear it. Then we also have places on a bus where we can quarantine a student. For instance, if a student comes on and has some symptoms that they may have had when they left home, but they were at the bus stop, we can't leave them at the bus stop. Wouldn't dare do that. We put them on the bus and they sit in a certain place, and then the school is notified when that child gets off the bus that there seems to be a problem, so that can be dealt with before the student goes throughout the building. So we're trying to do everything we can based on what we know is the safest thing to do, and then based also on the guidelines. And there may be times when we miss something, but I don't think we're missing much. I think we're pretty much on top of it. Chad mentioned spraying. I think when I came here maybe 4 years ago, before COVID, I was very familiar with the fact that sometimes schools and school systems close down because of the flu. And so I asked that we do the spraying starting even then before COVID, because I didn't want us to have to shut down because
Dr. Moore, let me stop you there. Just to reiterate that you started spraying during flu season when you first came to the system?
4 years ago, before COVID was ever talked about. We were spraying our schools. Now, we didn't spray them as often as we spray now, but we were spraying especially during the cold and flu season. So that, and I think, if I'm not mistaken, the same chemical that we use in some ways will fight the flu and it will fight COVID. But we didn't have any issues with having to close down a school or a classroom because of the flu, whereas other systems, even around us, had to close down maybe a part of their system because of flu issues. So we never had that. So we have been used to spraying. We have to spray more now than we did during the flu season 4 years ago, but we still were doing it at that point.
That's interesting.
So we bought more equipment, and so that we could actually spray as much as we need to.
Oh, thank you, Dr. Moore. Anyone else, any other thoughts before I turn it over to the audience if there are any questions? I do see that we have a few folks out there, so I do want to offer the opportunity for anyone who may have a question. I will meet you here with the microphone. Any other thoughts?
I think Dr. Moore kind of alluded to this. This has gone on for a long time, and it gets tiring, and parents get tired of things, teachers get tired of things, custodians, bus drivers. If anything that we're saying up here, if you see something like that in a school that's laxed or something that needs to be picked back up again, bring that to the attention of that administrator. Or if you know of something on a bus, bring that to our bus director, Mr. Brian Thornton. We're here to help. We don't have a crystal ball. We can't be all places at once, and we're only one person. But we're here to help, and we're here to do the very best we can do for our kids, and that's what we're here for. That's what all people go into education for. So give people a chance. People get tired and things happen. So bring that to that principal. Let that principal have a chance to make things better.
Thank you, Mr.
COVID
Anderson.
fatigue has set in, and a lot of us are just tired. You know, we are so used to enjoying our freedoms and liberties that we can
Commissioner, you said
enjoy.
it best. I'm ready for Thanksgiving and Christmas and you know, and all of that stuff.
Absolutely, but
is that likely, you know?
Well, it's likely, but with some provision in place. This is not the time to let our guards down. We have survived at the height of the pandemic, and it's because we instituted the measures and the protocols that CDC and other healthcare experts have recommended. And so it's not time to start taking your mask off and going out, you know, hanging out because you just feel like you got to do something. That might just be the time where, you know, you contract this virus if you let your guards down. So I'm saying, hang in there. Don't loosen your standards because COVID, you just got to behave as if COVID is everywhere. And it is, you know. And again, I go back, I'm not getting paid to promote vaccines, but I'm saying that it is the #1 preventive measure that we have available to us. And we need to make sure that we take it because you want to go out there, you want to kind of loosen, you know, some of the standards a little bit and get back to having a little fun. But you can't do that. You should not do that if you're not adhering to protocols and if you're not been vaccinated. Because even with that, you could still contract this virus, and it might slow you down for a little while. But it won't slow you down as long as it might if you have not been received any of the vaccines. Yeah, so
And I think, you know, in your opinion, Commissioner Sankey, as a healthcare professional, a longstanding healthcare professional in our community, and Nurse Rogers, if you want to lend to this conversation as well, it is safe to say that, you know, children, they want to go back to what is normal, and that is school. Can you speak a little about, you know, how important it is for students to kind of get back into that normal routine, but safely? And I do understand, you know, parents, you know, they're, you know, concerned about a lot of different things, but, you know, to do it safely is our priority as a school system.
No doubt about that. Kids want to interact with their peers. That just it's normal. It's part of our developmental process to interact with people our own age and to enjoy the first grade and the second grade and the third grade. If you all can think back on how important that was for each of us to have that interaction with our peers and get those socialization skills and all that. So it's very, very, very important. All of the children miss school. I hadn't talked to one child who say they don't miss school. You may ask them if they want to go back, they might tell you no, but they won't tell you that they don't really miss it. And so it's important to continue to exercise all the preventive measures that we've talked about this afternoon and this evening. And certainly we want to do everything we can to try to get back to some sense of normalcy because the educational arena is important. You can get all the virtual learning you want, and all that has its place, but interacting on a day-to-day basis with folks, you know, that of the same age as we are, as the children are, is very, very important, and you can't replace that. No degree of technology can replace what you get by being in the classroom and in that environment, interacting with others. And I also like the idea of not being too regimented. When you can, Dr. Moore mentioned, we can go outside, you know, when the weather permits and so forth. And I think maybe we ought to be looking at more of that, how we can go outside for a science class or a math class and use nature to help enhance the subject matter. So not being so regimented is I think is going to be very, very important, and changing the learning environment when the weather and time permits.
Well, thank you, Commissioner. Well, I do want to turn it over to the audience. If we have anyone with questions, please let us know by raising your hand, and Ms. Dotson will meet you with the microphone. Any questions in the audience tonight? Okay, we have a couple back here. And again, while Ms. Dotson is making her way to our first guest, we want to thank everyone for tuning in, and we want to thank our panel, and we'll go ahead. Thank you.
Jay, this is probably more for you, but you mentioned the town hall meeting several times. Is that something that's going to occur soon? I have more concern with COVID and protocols.
Yes, and just so I'll speak into the microphone, Dr. Moore and Chad, the question is about the general town hall meetings. Yes, ma'am, we reported that in our board meeting. And we do have one coming up in October. I hope to have that date out to the public by next week. Yeah, no problem.
That mic is not on, Ms. Dotson.
There's a button on the side here. What the audience wants to hear you at home. Okay.
That's going to be on the driver, and then also we have cameras on the bus. So if there is a bus in question, we can pull up the cameras and roll that back and see exactly who was on the bus at that particular time to help that driver out. You know, I mean, sometimes if there's 70 plus kids, I know they know their kids as they're coming on, and they probably recognize if somebody's not on there or not, or is on there, but that's why we have the camera backup as well. And then right now we have to put the transportation plan in and to the state and some other documentation with that. So they have a documented time and who is on the bus for each day so that we record those miles. The way we receive our funding for transportation is based upon that, on loaded and unloaded miles, and then also how many students are on the bus at that time too. So especially right now, the start of the year, those drivers are really focused on that part of it, making sure that happens. And then of course, like I said, we have the cameras to back us up as well for contact tracing.
Thank you.
I wanted to speak to Nurse Rogers about classes being sent home with students that if there's a positive test in the class or a suspected positive test, but they go to the doctor and they have a negative test, but that class has been sent home. How are we coming to those decisions? Is that part of the information you'll be sending out next week with the updated guidelines, just for the event that it was unnecessary to quarantine a whole class?
And we have had cases that we suspected or were told were positive, and then they weren't. For whatever reason, it turned out to be strep or something else. And we contacted those people who had been in quarantine, told them it would be okay to come on back. And what we do currently is if there are 2 or more cases being a positive test or a clinical COVID, which is, I think, Commissioner Sankey can speak to that as well. Clinical COVID, as far as Dr. Landers has described it to us, is an automatic or new loss of taste or smell, and that's considered clinical COVID in the children. So we would count that as a positive and send those close contacts home then. Now, if the mother takes the doctor to the child to the doctor, sorry, and the doctor says, no, this is not COVID, this is strep, then immediately that child can come back. But we have to have that documentation from a physician.
I want to add to that also before we move on. MPS has gotten a lot of attention because of some of the really great things that have happened in the last few years, where we accomplished some milestones that were thorns in our side at the time.
It's okay to say that we're coming off our intervention December 1. That's fine to say.
So a lot of people are really paying attention to us, and they call. So one of the things that's going to happen soon, Nurse Rogers, I don't know if you want to add to this or not, but we're going to be part of the UAB testing project for all of our elementary schools. So they're going to test with parental permission, of course, and parents will get those forms to give us permission. It's non-invasive. Invasive is going to be a swab in the mouth, not in the nose, and then they'll do it about twice a week, and then within 24 hours, you're going to get information back that says if you're positive. So we will have a quicker way of identifying in the elementary schools at first, and also with our employees if there is a problem. And so that is going to be a really great thing. We're going to start off with about 5
Yes,
schools
we're gonna-
next week.
We're going to start next week with 5 elementary schools, and we started in the elementary groups because they do stay in the same group of children, and we're more able to identify those children and who were there and that kind of thing. So UAB has come up with a team. They've got a vendor. They will be coming next week to visit those first 5 schools. Once we get a good and steady thing going, they're going to be going into all the elementary schools, and then as we'll be feeding into the middle and the high schools as well. It's called pool testing, and it is a swab, and it is a nasal swab. However, it's not the touch the back of your throat with the swab thing that we've all been through. We will be sending out parental consent forms for that if you want your child to be tested. On the days they come, for right now, they've decided they're going to do 1 day a week in every elementary school. After those first 5 pilot schools, they're going to do every student that they have the consent form for to do, and then the next week they will come back, and that way we can identify, okay, in this class they're not doing such a good job at trying to mitigate this. We see this class, and that'll help us as well as nurses also identify those close contacts.
Thank you. Mrs. Dotson, do you have a question there?
Yes. I know that some teachers have spent their personal, this is perhaps directed toward Mr. Anderson. I know a lot of teachers, some teachers have spent their personal funds purchasing the plexiglass and also the curtains in order to provide some distance between themselves and their students. I was under the impression that the plexiglass was going to be purchased for the classrooms. Is that not like such as out at that security desk?
No, ma'am, that's impossible to provide that for each one of those. The supply of it is the hard part. So when we purchase those, for some of the district, we try to do it for the ones that we're dealing with the public. What we did provide for every teacher is a clear face shield. And then we also, in that PPE cabinet that is supplied by Centos, there are clear face shields in that. So it is a form of plexiglass in front of your face that you can use with that, but just to be able to get all of that material to do it for the hundreds and close to 1,000 plus classrooms would be nearly impossible for us. It took us about 6 months to install the bottle filling stations in the schools, for 2 to 3 per school. Some of the larger schools we were able to put more in at once, and we're coming back around on those. It's just a manpower thing and then also a supply and issue thing as well.
Okay, and sort of related to that, could you please elaborate specifically on what is located in the locker besides just the shields?
Yes, ma'am, and we've given all this information to your administrators, and I hope they share with you. But in that cabinet, there are disposable face masks, clear face shields, sanitizer, disinfectant, wipes, alcohol wipes. I believe that's all that I can think of off the top of my head. But everything that we were supplying at the immediate part of it, for as far as cleaning and disinfecting, and then coverings as well. And then again, we've supplied well over 100,000 of the reusable face masks out in the district. Some were donated to us, and the quality wasn't great, but we've tried to come back and redo more of those, and to give everybody, everybody should have at least gotten 5 extra. That's what we kind of put out to the administrators to try to give each person 1 per day. And of course, I bring my own as well, and we encourage that also, to bring your own. Before we had the bottle filling stations, we supplied bottled water out in the district. We still do some of that periodically. Again, it's a supply and demand type thing, and getting that out. And then logistics is a very small group, so they're filling in for groups that are short. We also are having trouble hiring in a lot of our departments, not a lot of applicants out there, so They'll fill in for custodians. They're spraying at night. So things can kind of get backed up on us in that, and we try to make sure we do the priorities to make sure that you have the things, that your custodians have the things they need to clean their school and do it the most efficient and effective way. And then also, that's one of the things with the CentOS cabinet that we provided. And again, it's a fail-safe. It's there. We are still supplying all of those materials, but that is there if the school runs out of whatever we're supplying in the interim to make sure they fill in with it. So it's something that that's why we only gave a key to certain individuals in the school so that they could control the flow in and out of those materials.
Thank you, Mr. Anderson. Mrs. Dodson, do we have any other questions? We are at time, so we will want to wrap. Okay, one more question. Okay.
Nurse Rogers, I have one for you, because you specifically stated a situation that was a concern of mine. So what do we do if the way that you are describing things be handled, meaning a child is sick, he's sent home, he goes to the doctor says no COVID, doctor says can go back to school tomorrow, but that nurse or that school or whoever will not let the child come back, and specifically has sent kids home related to, I can say personally, this happened to me. My son was sent home. He tested negative twice. The doctor said come back to school the next day, and he was not allowed to for 10 days. And there were students sent home because of him. And
Okay. In the ADPH guidelines, and it's all on the ADPH website, it specifically states that a student cannot test out of quarantine. Now, if he comes back, it is allowable if they have an alternate diagnosis from their physician, and that's why I say for the doctor's note.
He was sent home, not because of quarantine. He was sent home because he was sick.
Well, it was because of either new loss of taste or smell, or he was exhibiting symptoms.
Okay, so you don't accept the doctor's excuse when they go take a negative test, even if he was the one sent home?
I think, let me jump in there real quickly, because I think you have some very specific questions. Is it safe to say that maybe after this, or if you'll shoot me a note to my email, can we talk about this? Is that fine? It looks like you have some, pretty detailed questions. I think she explained what the process is right now. Is that fair? Thank you, ma'am. Okay, all righty. I do, and I thank you all so much for coming out tonight. We're going to give final remarks. Again, thank you for those who are here and are watching us. We will start with Commissioner Sankey. Your final thoughts, 30 seconds.
Well, thank you so much, Ms. Jones and Dr. Moore and the rest of the staff for the invitation. I've certainly enjoyed this. Hopefully the people that are out watching and listening have gained some knowledge and so forth. And I think that all of us are concerned about the school system and making sure that the school is meeting the needs of the children. And the best way to do that is to have an environment conducive to learning, and that's going to be safe in terms of the health and wellness of our children. I cannot emphasize enough how important it is to get the vaccine for those who have not taken the vaccine. If you have any additional questions or reservations, hesitation, I'm always available. I'll be happy to engage you one-on-one to answer any questions that you might have as it relates to either one of the vaccines that are available. They've been tested. The research shows where they are effective, and COVID is everywhere, and it just behooves me to think that there are people who are still reluctant to take the vaccine when it's a very deadly virus, and we know that the vaccine is the #1 preventive measure as relates to staying safe from COVID. And please do consider getting the vaccine, and hopefully as more and more children are eligible to receive the vaccine based upon the research, the parents would be open to having their kids receive the vaccine, and I'm hoping to play a role in administering the vaccine to a large number of the school-aged children with parental consent. Thank you all so much.
Thank you, Commissioner Sankey. Dr. Moore, 30 seconds, your final thoughts.
I would like for everyone to know and understand that as a superintendent and all of the folks who work for the school system, that our number one concern and motivation every day is to take care of the children who come to us on a daily basis in loco parentis, in place of the parent. We're not going to please everybody, but when we think about 27,000 students, if we err on the side of caution and safety, we're looking at the whole group. Sometimes we do look at an individual child, but most of the time we have to consider what's happening for the whole group. And that's a little bit different from looking at an individual child name by name. And sometimes we may make an error on the side of caution, but it's for safety reasons. We try to follow the guidelines as much as possible. As they change, we'll change. And so we're doing the best we can. Talking about COVID fatigue, most of us pretty much in the last 2 years have had a day or so off. We don't even have weekends off because we have to stay on top of this. And so we appreciate those mothers and daddies who send their children to us every day.
Well, Dr. Moore, thank you so much. Commissioner Sankey, Nurse Rogers, and Mr. Anderson, thank you for taking our questions tonight. And again, for everyone here in the audience and at home watching, we thank you. We do encourage you to keep the line of communication open. As Mr. Anderson has mentioned, if you have questions related to what's happening in your school, contact your school administrator. If it's something district-wide, obviously, send us an email, and then we will escalate that to the appropriate department. So we do thank you all so much. Shameless plug, be on the lookout for our MPS Town Hall meeting, and then we'll go from there. And if that's it, I'll see y'all next time. Thank you.